everyone. Welcome to the Axios International webinar. Today, we will address the topic of what does patient confidentiality look in practice. I will introduce myself. I am Joselyne Rivera, General Director of Psiquepol, a Mexican public affairs and communications company. It is an honor for us to have you here today in this virtual forum organized by Axios International, a global access to healthcare company within over 25 years of experience in designing and implementing sustainable access solutions in more than 100 countries. Today, we meet with a common goal: to discuss the topics faced by the health sector in terms of regulations and patient confidentiality, explore the role of technology as a facilitator of health, and address the topics of access in remote communities and low prevalence diseases. As we know, regulations in this area are constantly evolving, which is why it is crucial to all actors in the health sector are aware of the latest regulations and best practices. We are joined by three experts from the health sector. I introduce to you Dr. Juana Inés Navarrete Martínez, a specialist in genetics and rare diseases, and coordinator of genetics and faculty of medicine at the National University of Mexico, UNAM. Carlos Salazar, medical device specialist and president of the National Association of Health Providers, ANAPS, which is a non-profit social organization focused on modernizing the practices, techniques, and medical supplies that our country lacks. And we have also Silvia Méndez, country operations lead in Mexico from Axios International. Their experience and knowledge will be great value in helping us better understanding this complex situation regarding compliance, patient confidentiality, and the role played by technology, which often moves faster than regulations. The format of today's webinar is a roundtable discussion. I will propose a topic, and each of you will provide your point of view up to 3 minutes, please, followed by a brief discussion. Please use the raise hand and feature on the platform to indicate that you all like to speak, and I will give you the floor so the public who watches can hear everyone speak clearly. While the other speakers take the word, please mute your microphone. So let's start with the first round. The first topic to discuss is the current challenges faced by the health sector in terms of regulations around patient confidentiality, which are changing rapidly. So it's essential to understand where they are headed in the short, medium, and long term. Today, we would like to hear from you, our experts, how policies and laws are evolving and how we can adapt to meet these requirements while always protecting patient privacy and rights. So I invite you, please, Dr. Navarrete, to start this with your national experience. Thank you.
Yes, of course. As you know, Mexico has a fragmented system of health system. So although there's a national health where all the patients go, there's the private sector and there's the public sector, which is also divided in different sectors, not Pemex, the people that work at the military, the naval, the people that work from the state. So each one has its own, although there's a general policy, they have each one specific policies. But nowadays, I think this is a very important seminar because we are moving to a union of a gathering of all the laws for all the patients. I will tell you my experience in where I worked for 35 years in Pemex, in which it's mandatory before you go to sign a special confidentiality paper where you enter to a special proceeding, or if you take in some of a test, a laboratory test, you have also to. So I think its institution has its own, but very laws to protect patients' confidentiality.
Thank you, Dr. Navarrete. Now, Carlos, what do you think about this in the international experience and local experience you have?
Well, thank you. First of all, we are very thankful for the invitation. And regarding to the question, currently, as we know, we do not have a specific regulation in Mexico for the practice of telemedicine with a complete federal scope. There was a draft on the project in 2015. It was the NOM 036 promoted in December that we should aim to establish the procedures that staff must follow to provide remote medical care services, and as well the minimum infrastructure that the people must have to observe the places and provide the services and warranty, of course, the good practice of telemedicine. However, this project was canceled in April 2018, and there was another similar project in March 2021 that was presented in the Chamber of Deputies that it's just set up there, and we haven't had some advances on that. So the Mexican Ministry of Health has implemented telemedicine through more than 600 health centers in 22 entities. And as Doctora Navarrete says, institutions as IMSS, Sedena, and Pemex, that are the biggest one in Mexico, has right now a bunch of medical professionals that want or are aimed to use these kind of technologies to have or to promote the medical services. We think that right now the people are open to work with this kind of technologies, but the regulation still being a big matter to combine these efforts with solutions that can open the technology to the Mexican ministry. Just in 2022, the health minister offered more than 2 million remote care procedures. The majority of them was diagnostic interpretations. Second place was occupied by procedures of COVID-19. The third one was monitoring of the same pandemic diseases. But unfortunately, this doesn't represent more than 5% of the total procedures in the use of telemedicine. However, a study that we show that it was made by MIT Technology and NTT Data shows that more than 60% of healthcare companies in Mexico use right now digital media for more than half of their customers. And for 2023, 47% of the medical consultations in the private sectors was carried out by telemedicine. So it's growing so fast in the last years. It's growing so quick. But the thing again is we need to control the system to give the secureness and the confidence to the users that the data, the confidential data of them will be supported by the law and the regulation. Of course, the lack of a clear and updated regulatory standard to support these kind of technologies has really affected the adoption and the impulse of the updating of the health system in our country. So our point of view is we need to push. We need to push together industry, the government, the states. There's a big movement about the medical tourism that could be very affected if the Mexican regulations don't apply to these procedures, to these norms, to these laws that can be secure for the people and the companies.
Thank you, Carlos. You touched very important point of view. We return with some of that. Silvia, can you complement your share point of view?
Yes, thank you, Joselyne. Yeah, so I think that effective regional governance and cooperation within Latin America is very necessary for a broader conversation on the region's role in a rapidly changing global order shaped by technologies. As we were saying, this transformation is needed as the healthcare is changing. So relevant laws and regulations concerning patient confidentiality and safety in Mexico, we have some, as Carlos was saying, like telemedicine, we are lacking of laws or regulations that could lead us to promote this or implement this service with the patients. Evolving policies and laws around the patient data privacy and the rights are shaped by advancements also in technology and growing awareness of the patient rights. Compliance with local regulations is very important to ensure the market access and also patient data safety. In Axios, in compliance with relevant laws, we have served almost 9.5 million patients around the world. And all the patients participating in all of our initiatives worldwide provide their consent before starting any treatment within Axios programs. We also educate them about their roles and rights during their treatment journey. And as Axios, we have also integrated some digital healthcare system through a platform that's called Axios Plus that enable patients to connect to healthcare and treatment while we ensure their data and safety are protected at every point during their journey within the program in Axios. Also, we have implemented a strong compliance infrastructure to mitigate risks. We comply with all the local laws and regulations relevant to data privacy and data protection, including the European GDPR. In Mexico, we have the law for data privacy in possession of third parties, being one of the strictest regulations across the globe, the European one. We also have implemented strict data privacy policies controls that align with the GDPR criteria for collecting, processing, using, storing, and also destroying the personal information of the patients. So for Axios, safeguarding the data is a core priority, and this commitment is reflected in our adherence to the world's most stringent standards and regulations.
Thank you, Silvia. So I would like to focus on this. Like, do you have all heard about best practice in a country, an international case that you like to bring to the table, just to hear about how, for example, regulation in telemedicine is coming up in or taking advantage in other countries, so we can maybe like copy that regulation and share it with the audience? Carlos?
Yeah, for sure. Well, India, Thailand, and some other countries, South Korea, are working huge in developing the technologies against to the telemedicine and connectiveness around the world. Because right now the modern medicine asks not to see just the health with the absence of any sickness. It's talking about how the people can feel secureness in the treatments, can feel safety, can feel healthy, So what's the future is showing to us is we must be more and more connected between patients and doctors. So the doctor right now is not just about, I'm going to give you the treatment and that's it, and just follow the steps, You need to follow the treatment until the patient can feel totally secure. That's why for us it's very important to improve all these norms and laws. And I think just public politics and norms and laws are just the beginning, because in Mexico we have a huge challenge about technology. We have a huge challenge thinking about how the culture of the Mexican health professionals and of course the users has the confidence to apply to digital network as they started to apply it in the e-commerce, with this financial risk some years ago, and the education, the digital educations. So it happens, it happens in the last years, where the people start to gain confidence and start to promote this kind of technologies. But now we are speaking about health. We are speaking about not just confidence of something that doesn't affect me really important in my health, So for us, we need to achieve a good telemedicine system with electronic clinical records, working it from the education, from the training of health personnel, investing in equipment and telecommunication, of course, as you said, specifically in the rural areas that we have a lot in Mexico. And the encryptation systems, that is a big point, that how even that you can protect the data with laws, with norms. How can you protect it by people that want this data to have a bad use of it, you know? And the most important thing, I think, is the culture of managing the public and the private collaboration. This big step need to develop more security and confidence standards for the users.
So you say something that I would like to ask to Dr. Navarrete about the connectivity between the medical, the professional, and the patients. How does the telemedicine works for you, for example, in your experience, doctor?
I think for us it's very important. As now the National University of Mexico, together with the National Health like a foundation, they are making a special next month, it's beginning, that's called the Precision Medicine and Telemedicine for all doctors that want to go into this modern age. That's very important. Education, one thing. And the other thing is, how can you integrate all this in public medicine, not only in private medicine, which I think it's advanced, it's taken a lot of new technologies and everything, private medicine, but we are interested also in public medicine. So you have to make a lot of steps. First of all, a group of patients and doctors that are interested in this have to go to the different chambers in medicine, especially first the deputies, in order to promote a general law in confidentiality. And then if it's approved and you have to be there for the discussions and say why it's very important, then you discuss with the lawyers, the deputies and everything. If it's approved, it goes to with the senators. And if it's approved, then it becomes an official norm that it's regulated by the health system, the health ministry, and then it's written and it's the same for everyone. So I think that these modern technologies have to, little by little, now I think they are expanding a lot in private medicine. Little by little, they are expanding also in public health, in some institutes, like the Seguro Social, the ELISTE, that are for the workers for the government. Pemex, we have a long time. I have the experience. Everything was like not only telemedicine also, but we have the electronic experience, and now we also have the electronic recipes long ago. Now they're going all going to be in public. So I think it's a lot of work, and we have to be like by the hand, doctors and lawyers, patients associations, in order to make this, to push to have new laws that they will be national all over the country.
Thank you, Doctora. And Silvia, do you want to complement?
Yeah, this is something very important that Carlos and Dr. Navarrete were saying. And also, I think one of the initiatives that the new government will try to implement, let's hope it works, is the digital clinical record and the communication between the institutions. Because even if I go to IMSS and two different hospitals within IMSS, they don't know what they have made to me within each other. So I think this is very important. I hope it really goes forward, because it will give continuity to the treatment of the patients, and the physicians will know what they can do, what they have done, and now how to move forward with the treatment of the patients. So I think this is also very important to mention and to have into account to see if it goes forward in the next months.
We need to bring a lawyer to the table here. So we are moving also to the second round. We also talk about the technology, but technology in health, as you've seen, is not only the telemedicine, is the clinical electronic record, artificial intelligence, machine learning, all the medical devices, of course. All of these are revolutionizing the way healthcare is delivered. However, these advances also come with new challenges and benefits. How can these tools improve patient care? What do you think about it now? And how can they increase efficiency and at the same time ensure the patient confidentiality so it's not being compromised? So, Carlos, what do you think about this topic?
Well, thank you. Well, what I can talk about this is about the great impact that technology trends have applying for the world of medical devices, and why do we affirm that technology applied to medical devices could radically change the world on the health systems. In the recent years, in the recent decades, the technology innovation has radically transformed our industry. I'm talking about medical devices, creating very high sophisticated and linked medical devices, one with other can connect and give some information, changing the way that health is diagnosed and treated and preventing the sickness and disease. For example, like as you said, the artificial intelligence and this algorithm that you can handle together allow us to analyze big sets of genomic data and clinical information, as well as procedures around the world that can give us some risk factors that help us to obtain and improve some patient outcomes. Of course, this connected with the advances of genomic and personalized medicine allow us to analyze the genetic information of each person to obtain a much more clear diagnosis, maximizing the effectiveness of therapies and reducing the side effects of the general treatments. We have this genomic information applied already to some early detection tests against cancer, prenatal diagnosis, hereditary cardiovascular risk, early detection of rare diseases, infection diseases, chronic diseases, etc., etc. There's a lot of different sickness or different diseases that the technology can predict or prevent from some huge impact on the patient. And another big tendency is the Internet of Things, the IoT. This trend is highly accepted by a very large number of medical devices, more and more in the last years, which through connectivity and remote monitoring of patients, like in adulthood, that has chronic diseases or require continuous care, wearables can prevent any big success in the patient. So the medical devices right now has this big vision about connectivity, about to have less cost in the use of any single medical device, like smartwatches or even a single shirt that can constantly have a monitoring of cardiac effects, and of course a lot of medical devices on rehabilitation. So this is just some specific trends that we can find applied to medical devices, but there's a lot of technology tendencies that we can study and see in which kind of technology are medical devices having some developments. So let's imagine that the future in medicine, where medical devices are not just only to treat diseases, so it can also increase and promote the quality of life of the people with these big technologies, that we can see a path of proactive healthcare solutions. So for us, it's very important when we speak about technology connected to the patients and these patients connecting to the doctors. We can see a big ecosystem working together, trying to push the best solutions for the health system.
Thank you, Carlos. Silvia?
Thank you, Joselyne. Yeah, so the implementation of this digital has few challenges, including data privacy and security, we have to take into account some regulatory and compliance issues, the cost of the implementation of this digital telemedicine, AI, ML, the resistance to change, because it's very important that sometimes some of the physicians, stakeholders, or even patients, they don't want to go to the technology. So this is also very important to educate and train people to let them know the efficiency and the benefits that the digital telemedicine and everything will have the impact in their healthcare system or in their health. Also, we can address these challenges through a comprehensive, multifaceted approach involving some technological, regulatory, financial, and cultural strategies that will depend in each of the countries that we will implement this digital background, we can engage also the stakeholders, including the patients, the healthcare providers, policymakers, technology developers, for a successful implementation of the health technologies, As I mentioned earlier, compliance with local regulations is very important to ensure market access and patient data safety. Also, as Carlos was saying, this has a huge impact in the quality of life of patients, and also how the physicians will follow up the treatment of their patients. In Axios, we have this platform, as I was saying earlier, Axios Plus, that will let the physician follow up on the patient's status within the program journey. The patient will have all the information he needs to follow up on its treatment, to adhere to it. And also the distributors or the pharmacies will have the access to know when the patient should start the next treatment. So, and when to deliver, where to deliver. So this is very important because this will mitigate some gaps that we already have within the patient's treatments, and it will be helpful, but we need to be trained and educated so we understand the benefits of having this implemented in our systems.
Thank you, Silvia. Dr. Navarrete, please.
Yes, well, I think all of the discussion, it's very important, but I think we are moving, as Dr. Carlos Salazar touched, we are moving into also, I think all this new technology, it's very important, not only for treating the patient and diagnosis, in which we have to move and make the laws, as I was telling before, but to preventive medicine. I think the future is preventive medicine also, because through preventive medicine, many of the very lethal disease that end in a very bad quality of life or death can be prevented since you are born with a neonatal screening, for example. And in this new era and technologies, with the new coming of the new technologies in genomic medicine, you can also have a lot of diseases that are not diagnosed when the baby is born. You can diagnose them and treat them before they have any clinical manifestations. So you change really not only the quality of life, the life of that person that maybe would be have mental retardation or many disabilities that they cannot be cured in the future. So if you detect them when the baby is born, then you'll have like a healthy population. And I think these technologies are of great use in all this diagnosis in neonatal screening.
Carlos, please.
Yeah, and we are speaking about technology and about big data, So if we cannot control the regulations, if we cannot control this data, and just imagine this a big trouble where, I don't know, somebody infects the system or plays some information that is not good information, what will happen not just to the people, to the countries, It can has big events of health troubles around the world. So for us, it's very important. It's not about what just a city, what just a country as Mexico thinks. It's a worldwide worry. It's a worldwide commitment about technology to where we need to control all these norms, all these laws that can provide this kind of secureness, this kind of confidence to the users.
That is very important, Carlos, because the information is the power of everything. So if our information, like as a patient, you don't know where is your information. So there may be many people that it's afraid of sharing it, and of course also the institutions. No, so that's a big challenge we are all facing. The sharing of the information. You, Silvia, told about it, that between the public institutions, the information is not being shared. No, the electronic record, you don't have it as a person in Mexico. You are not the owner of the clinical record. So you have to ask it, no, and request it for to the institution in order to have it. So that's a big issue here, and it's a discussion that who should have the information, the institution, the medical, the professional, or the patient. What do you think about it? I would like to hear you, Silvia.
Yes.
Silvia, and then Dr. Navarrete.
Thank you. Yeah, so this is a huge issue, to confront, because the patient owns the disease, their information, it's theirs, but there's no regulation or law that says or states that the patient owns their clinical record. And that stays in the hospital, and then you have to request it, as you said. And this is something that we need to discuss further, because obviously the institution needs to have this information with your consent, with the patient's consent, in order to diagnose, treat, provide all the medical services that are needed for the patient. So this needs to stay also at the hospital with the previous consent of the patient, but also the patient should have access to it just to know what's going on. If you go to one side, then you're giving all the power to the patient, but if you give it to the other side, then you're giving all the power to the institutions, and that cannot be, there has to be like a middle point to it, So I think there's a lot of path to go through, but at some point we will get there. But there are some things that we need to review with some other instances, so we make sure that we are fully securing the data protection of the patients.
Dr. Navarrete?
I think this point that you touched, this specific issue, it's very important, as you say, because what do we have nowadays? Nowadays, as you said before, it's institution, for example, again, talking in payments, in which I worked before, you have all the electronic file. It's electronic, so each doctor, you have to have a special clue for each one in order you can get into the system. And it's very important, for example, if you have an accident or a disease in one of the hospitals in Campeche, in Veracruz, you can go in and see the X-ray and give your opinion, or see the lab analysis also. And so I think this modern thing, it's very important, because of course, this file, which belongs to the patient, but you can see it in the system wherever you are, if you are in the health system of Pemex, of a specific, no? So you can, if you have to give an opinion in everywhere in the country where there's a hospital, you can get in. But I think it's very important, as you said, what about the patient? The patient doesn't have any of this information, or doesn't have its own lab analysis, or X-rays, or SCT scan, anything. So if you have to go to have an opinion of a doctor outside, or physician outside the system, you have to ask for the information, and they won't give you the studies. They will give you an opinion of what they found. So although it's your health and it's your body, it doesn't belong to you. It belongs to the system. So I think we have to look at a lot of things in regulations, no? And I think it's the same for other systems, el Seguro Social or the health, el ISSSTE for the works of the workers of the government, for the different systems. I think it's the same. I think that's only the private systems in which you have your analysis, but it also belongs to the hospital, so they can find you or your files. That's all that we have to work a lot together in order to advance in these regulations.
Totally. Carlos, you want to?
Yeah, I just want to add that it's important to think that the patient must have this information, not just to check all the data information from the past. It must, like in medical devices, we have some laws, some norms that we need to control all the situations or all the solutions, all the results that a medical device leaves around the complete life of the medical device, So this is a rule, this is a norm called technovigilancia, technosurveillance in Mexico. And but we don't have in the patients, it's like something funny. We don't have like in the complete life of the patient, how many treatments does he take? How was the results of these treatments? How was the results of these treatments that the doctors decide to place in some people? And of course, the patient, when they are attended by the ISSSTE and they want to move to the private sector, they need to start again. They need to understand that it's going from the beginning again. So if there was a treatment that works or didn't work to him, you cannot check it out. You cannot go back and give the results to doctors, and maybe the doctors think, okay, so this treatment must be changed. So it's very popular in Mexico that you make a lot of studies in some hospital, and then when you move, they ask for the same studies again. They cannot check the history or the data from the patient. So we have a big challenge here in order to think about connectivity from the systems of the hospitals, even if they're private, public, or if it's ISSSTE or Sedena or IMSS. We need to establish the rules to have just one big connectivity platform that can give all the information for many different institutes.
Yeah, so let's move deeper in this, because we are talking about the use of the technology, but what about the low-income people or the remote communities, or worst, of having a rare disease in those rare and remote communities? So we have the technology, we have maybe here the connectivity in the cities, in the urban locations, but how we can take advantage of these technologies, or what are your thoughts or best practices that you have for those people, which in Mexico represents a lot of millions, by the way. And maybe we have advanced and some access to institutions, but really the use of the technology and of course, if we want to talk about rare diseases or low prevalence diseases, what are your thoughts regarding all we have discussing? So Dr. Navarrete, and then Silvia, and then Carlos, please. Thank you.
In regard to rare diseases, I think we also have advanced because who are the main people that have been interested in making early diagnosis in rare diseases in remote little towns or villages in the country, not only in the big cities? And I will, the patients. The patients we have gathered together, like in other countries, and make associations for different rare diseases or very rare diseases, and then they have a voice. They say, well, I heard that there's a patient with this very rare disease in this, and they go and they help with their own media that they gather all together so the patient can have access to a public hospital to make the diagnosis and the possible treatment, which in many ways it's very, very expensive. But what it's important is that they have a voice and they have come here to the big cities or to Mexico City or the big capitals of the other states and make public their need to have a treatment and a diagnosis in the public health system. And a little bit, they have, for example, before the term rare disease didn't exist in our constitution, in our legal book, in our regulatory norms laws. So they only said that the certain medicines you can use for rare diseases, and that's the only time the word appeared. So now, after making a lot, all these associations have made a lot of voice and noise, and now every rare diseases, it's now in our book, in our law book, that there are a lot of diseases recognized by the OMS, by the regular sanitary, the World Health Organization, and now they are recognized in our country, so you can hear they are rare diseases. And little by little, I think we have to make these changes so these patients have access to our health systems, especially the ones that have no access to any of IMSS or ISTE or the public health. So I think we have a lot of work to do.
Yeah, and that's a great news to hear about the changes in the general health law, including all the recognition by the WHO classification of the rare diseases. Yes.
Yes. This was last year only. Last year.
Silvia?
Thank you. So for people or patients who live in remote places or rural communities, they have access to treatment, but it's very limited, or healthcare. Sometimes they don't even have enough money to do the transportation, to the clinic or the hospitals. So this relies on late diagnosis, late treatments to the patients. And as Dr. Navarrete was saying, there were regulatory changes that are now improving a little by little, how patients in these places can move forward and seek for this healthcare attention. Within the associations, patient associations, they seek through how to get this attention and how to get to a physician, to specialists, and then to the treatment, diagnosed and treatment. We have a lot of things to do, education and awareness on these diseases, on how they can get access to the healthcare system, to their diagnosis, to treatment, to laboratories, because they don't even know how the path will go, which journey they have to take to get to the final diagnosis and finally get healthy or have a little bit of better quality of life. In Axios, for example, these technology barriers that they experience sometimes, because sometimes in those communities there are no internet access also, and they have to go somewhere else or to another community to get it. So it is easier to get to the other community than getting to the capital of their state to get some attention. So we have used these technology barriers in Axios within an app that we have with the programs that we are running right now in Mexico, where the patient can just log in and see his appointments with the physicians. So he knows where to go, where to start, what is the next step in his journey so he can get diagnosed, and also when is the next treatment date. So we have used this technology or digital platform to help them to know what is the next step on their journey. A lot of education is needed for everyone, stakeholders, patients, distributors, pharmacies, that will be engaged with these patients that are not easily to locate or to contact with. and to provide them whatever is needed for them to have a healthcare quality services.
Carlos?
Yeah, I totally agree with Silvia and Dr. Navarrete. Of course, the limited connectivity is one of the biggest challenges. The people in the rural areas don't have the equipment that must have to give this connectivity. The lack of the high-speed internet infrastructure in the rural areas. Of course, the cost of this equipment is a big challenge for the states and the government. Then the staff training is a big challenge too. We must have, of course, maintenance and technical support people that can understand how they can make this kind of connectivity and of course the software compatibility between one application and another. The cultural barriers are a big point on this. People in the rural areas always think they are good, they are okay, they live good, they live better than the people on the cities, you know. So this is a very big point, the cultural barriers, the how can we train them and give them some solutions where they can think that is better for them. Most of them, they don't want to go to the hospitals, you know. They just they go to the hospital when they're or with the doctor when there's something really bad or there's something huge, you know. So we must work a lot in the cultural barriers and of course the regulation and policies that applies for all these people. But against this, I want to place in the table that there must be it must be a clear government investment project where the return of investment can be controlled and can be getting better and better, because we know that it's very, very expensive for our government to attend so many health troubles that came from the not preventing on time I don't know, any kind of starting sickness, you know. If we can understand that in the future, if we work in prevention, if we work in prediction of this kind of issues, of this kind of sickness, for sure the economic system will not be a matter, you know, the investment will not be a matter, because Mexico is investing a lot of money. Mexico is expending a lot of money, solving troubles that are really complicated. And it's crazy how a disease can get crazy expensive during the time of the diagnosis.
Yeah, totally agree. I think one of the big challenges in Mexico system is the health investment and where to begin with. Like we begin in digital investment or in medicines or in third level of attention or in primary care. So yes, we have a lot of challenge, and we are closing the webinar. I would like to make this like the last round, asking you the opportunities you see. You all speak about the challenges and the troubles, the issues you see in technology, in patient confidentiality, but what opportunities you see regarding we have new government, we have new authorities. I would like to hear you about like your conclusion and your proposals. You say a lot of I think very important proposals like education, capacitation of medicines, and use of technology, promoting laws, regulations. So what are your final thoughts about the opportunities you see? Thank you. Who would like to begin? Carlos, then Dr. Navarrete, and we close with Silvia. Thank you.
I want to set my point in the medical tourism. Mexico has been a leading destination in medical tourism from all over the world. Right now, we are in the second place around the world in medical tourism, thanks to the quality of health services, the competitiveness of medical procedure cost, the advanced treatments that we have in Mexico. There's treatments as odontology, plastic surgery, bariatric surgery, ophthalmology, oncology procedures. However, there's a huge risk that I want to give us an example of what will happen if our country does not update immediately the implementation of federal standards, laws, and norms of the procedures to adopt these new technologies. As Mexico has established as the second most popular destination for medical tourism in the world, just below Thailand, the data of the Health Ministry and the Ministry of Tourism gives tells that Mexico receives between 1.4 and 3 million medical tourists by year, generating a huge and significant economic impact that exceeds more than $8,000 million per year. So we can see that this is a very huge income from the health system, and of course for Mexico. The main medical tourists that came to Mexico became from USA, Canada, of course, because the closeness of the countries. And the cities that are leading this medical tourism movement are, of course, the ones next to the borders and others that we have in the beautiful beaches of Mexico, of course, especially some of them in Tijuana, Mexicali, Chihuahua, Monterrey, Puerto Vallarta, Cancun, etc. Cities that should be pushing hard, and I want to focus on this, the urgency of the regulation standards that allow them to continue being a competitive option in the medical tourism market. There are great and big and huge investments that have been made in these different states, but very small results that we have had in as an industry in the warning to the government that if we do not adopt these technologies, there will be countries that will gain this market share from Mexico. So countries, as I told in the past, as India, United Arab Emirates, Thailand, are offering a complete medical service program that include not just the procedure, include the post-operative service with the quite important results that their patients are recommending it, because they can connect, and not just connect, collaborate internationally with their patients, and of course with other care professionals to keep managing the patients. So therefore, we may lose this lead position if we don't adopt and modernize the healthcare technologies in Mexico, especially those technologies that can offer remote follow-up and timely monitoring and patients by digital systems. So telemedicine and other digital tools can support this monitoring, offering some virtual consultations, remote monitoring of vital signs, taking care about big issues, big troubles and disease, and of course, access to the electronic medical records that we have been speaking about this. So for us, the international patients need fluid and efficient communication with their doctors constantly, not just in the moment of the procedure, against of all the procedure. And of course, the lack of implementation of these technologies can lead a negative perception of the quality of the health care services in Mexico, as well of the medical tourism in Mexico. So that's why for us to be here, to participate with you in this type of events is essential. We should not minimize the negative economic and social impact that the delay of the federal regulations and laws in medical technology can generate in Mexico. So that's the point I want to set up. It's critical. It can be affected the economics and of course the social system in Mexico.
Thank you very much, Carlos, for your final considerations. And then, Dr. Navarrete, please.
Well, again, I am saying, although we have a lot to do, as you said before, in the laws and in the regulations of our system, I think that the future for our patients and for the Mexicans are the prevent, as in many countries, as preventive medicine, using all these new technologies in diagnosing in advance when there's still no manifestations. The investment can be made in preventive medicine, no? As I told you, in neonatal screening, with the new advances of technology, the new genomic tools we have, in order to that, so when the baby is born, we can diagnose what are the important diseases that they can have. So you can, in that moment, start treatment for some of the diseases, for like example, inborn errors of metabolism, or in others, looking through the life of this kid in order to have a normal life when he's an adolescent or an adult. How? Because you know what disease they have a probability to have great because of their genetics. And so you can monitor and propose to them a healthy way of life, of a different life. So that way you are you're planning for tomorrow, having healthy citizens, healthy people. So I think technology can be used and invest in preventive medicine. That's my
Thank you, Doctor. Totally agree with that. Silvia, please, your final thoughts.
Yes. So as Carlos and Dr. Navarrete was saying, I really think that investing in prevention will lead us to a healthier healthcare system, which give us opportunity to take care of the disease before it gets worsened, and it needs a lot more lab studies, treatments, and at some point getting to a final destiny, which we are all trying to avoid. I think prevention is the key of everything. Also, I think regarding the implementation of technologies and everything, Mexico has to update the regulations and laws regarding the patient data safeguard. As I was saying, in Axios, we have patients that can control their personal data. They know what we have from them, and at the point that they want, they can retrieve that data from us. You know, they can request to delete all their personal data and to stop contact with them, and that's what we do. We find that the regulations in Europe are more strict, so that's what we base on those, but also we have local regulations that we have to base on. So we take the best of both and try to make the best safeguard of the patient data within our systems. Also, transforming the access to healthcare while safeguarding the patient confidentiality and data safety, it is imperative in all the countries, not just in Mexico, everywhere. Because with the right regulatory framework and the ongoing innovation with the transformation digital healthcare system, we can ensure the utmost protection for the patient information. This is a dynamic and evolving field, and I think we can lead the way together.
Thank you, Silvia. Well, thank you all for your proposals, your key points. As a general conclusion, we can say that we all agree that we need to work, private sector organizations and health professionals, together with authorities and legislators in order to strengthen the patient confidentiality, of course, and the digital health regulations to improve the healthcare attention by taking advantage of all the innovation and all the technological tools, but always putting as a priority the patient privacy and safety. That's the key point, of course. So this strength and regulations can lead us to establish best compliance practices in all the healthcare ecosystem, and we all need to fulfill the common goal that is overcome those challenges, no? To make the full access to healthcare attention, and especially to focus on the access of low-income patients and the remote communities, so they can really get their early diagnosis attention. And of course, a key point you said all is that we need to prevent, to make more prevention of the diseases. So I finally, we are closing this webinar. I would like to thank you very much for your participation. And we have a really great panelist today, and thank you all for sharing your knowledge and your experience. And we recognize that this event wouldn't be possible without your support and collaboration. So have a very good day, and thank you all for connecting here today.
Thank you very much, Joselyne. Thank you, Doctora
Thank you.
Navarrete. Thank you, Silvia.
Thank you very much.
Thank
Okay.
you,
Thank
Carlos.
Axios, transforming access to healthcare.